Hi, my name is Chen and I'm a laser technician at Vancouver Laser and Skincare Center. Today we'll take a closer look at melasma and explore some practical strategies for handling it effectively. Melasma is one of the most difficult skin conditions to treat. It can be caused by hormone changes, sun exposure, genetics, and aging. Recognizing its three types, epidermal, dermal, and mixed, is crucial for effective treatment. Treating melasma goes beyond targeting the pigment in the melanocyte. It involves addressing underlying issues like hypervascular problems, leaky basement membranes, and malfunctioning fibroblasts. While melasma isn't curable, proper treatment is crucial for its management. It can darken without proper care, becoming more challenging to lighten. The melasma protocol is a comprehensive approach addressing underlying issues beyond melanocytes. Our approach to addressing melasma starts with the daily application of a topical prescription treatment. Following a minimum of 2 weeks utilizing depigmenting topical agents, we progress to the advanced treatment phase. During this phase, we implement advanced bi-weekly treatments employing diverse modalities to target vasculature, basement membrane, and pigment cells. Specifically, we utilize technologies such as Sulfurm, Picaway, Fotona, DP4, Moxie, and Halo. These treatments are easily accessible in our clinic and play a crucial role in the effective management of melasma. Maintenance is key, and we offer various options including treatments and our custom Vivier melasma kit to keep your skin looking its best. Melasma may be challenging, but with the right combination of treatments and a personalized approach, we can make significant strides in managing and minimizing its impact. If you have any questions or concerns, feel free to reach out to us at Vancouver Laser and Skincare Center.